I'm Brooke, owner of Straight Up Sales Orthodontic Coaching. Thanks for being here with me for another video on treatment coordinator training and sales success for orthodontic practices. I want to talk about the path that your treatment coordinator has taken in their career journey that led them to being a treatment coordinator, and the way in which the position needs to be trained based on that individual's professional experience leading up to their role as a treatment coordinator. So if it's someone who's coming into the position with no background in orthodontics or dentistry, they've got customer service or sales experience and awesome personality, they're a great fit for the role based on personality, confidence, drive, leadership, and you're going to train them in the skill sets necessary to execute that position. That seems to be the easiest way for practice managers and orthodontist doctors to kind of bring someone in and educate. There seems to be a little bit more hand holding, a little bit more education given to those people because you're coming from the perspective, the understanding that there's no orthodontic background within that individual. So it's not just learning software processes, but it's really learning teeth, it's learning tech, it's learning tools, it's learning style. And so those individuals seem to really get more like a leaning in and guidance within the position. Now I see people who get promoted from the front desk and they already know the software, they know the scheduling, they know the patients, they have buy-in for the practice. Their training seems to be a lot shorter. There's kind of this assumption that if they have an awesome personality, a desire for that position, it's a move up for them for their career. You already have the know, like, and trust factor, kind of mutual. They're bought into the practice. You believe in them as an individual to be capable of doing that job. And so the training is often really small. It's maybe some shadowing and waiting for that person to ask questions sometimes for what kind of guidance they would need in learning that position. Now, if someone is getting promoted from the clinic to become a treatment coordinator, again, there is a little bit more training that I see in kind of working on maybe different softwares, ways of presenting information. But let's talk about clinicians getting transferred into the treatment coordinator position as kind of the meat and potatoes of this particular training video. When you're moving someone from the clinic to become a treatment coordinator, you aren't just moving them from the back office to the front office. This isn't answering the phone, scheduling. Yes, they know the software, they have the buy-in. You clearly trust their personality and want to give them this opportunity to become your treatment coordinator. But the way in which you communicate with someone when you want them to go from shopper to buyer is completely different than the way in which you communicate with someone who is already your active patient. So while your clinicians have experience in customer service, clearly in making your patients happy and delivering an amazing experience, it is important to realize that the comfort level of a clinician is going to be to talk about teeth, tech, and tools in a more strategic or specific way that is the nature of clinical transformation. And that can take your shopper into the weeds. It can become really confusing. Maybe you're discussing things that are like a 6 months down the road as opposed to staying at the starting line. So I see sometimes that internally promoted clinicians to treatment coordinator are struggling with their conversion and really the buy-in and enjoyment of being a treatment coordinator because there isn't the right kind of training to help them succeed in that position. So, what they need, what your treatment coordinator who is now a treatment, or your clinician who is now a treatment coordinator needs from the practice, needs in training, is sales skills. Those soft skills in earning trust, in understanding what someone knows and doesn't know, what they want, what they're excited about, what they fear, and then how do you attach the service to that want, desire, and need in a way that is sales first, that is earning trust and earning the commitment as opposed to getting into the nitty gritty of treatment. So when I'm coaching treatment coordinators with a clinical background, we're often talking about undoing the really complex, smart, highly educated, and accurate descriptions that they're delivering to the patient when answering questions. It's not that that information is wrong, it's accurate, it's good information, but it's not what the shopper needs to buy. So that's what I want to challenge you to consider. What does your shopper need to say yes, to get started? And often it's not most of what we are communicating during the consultation. So if you're thinking about it as a free consultation to provide information with hopes that they'll get started, you're going to show up to that meeting very differently. It's more like throwing information at the wall and hoping that something sticks. Where if you are learning, inviting sharing from the patient, really staying at the starting line, and creating an experience for the patient. We want this to be a new patient experience that draws them in, earns their trust, gets them bought in. We want them sold before money is discussed, excited about getting started before they meet the doctor. And all of that comes from personality, from really leaning in, and from saying less than you probably think is necessary, which can be frustrating. This can be frustrating for the clinical background treatment coordinator. It's frustrating for doctors. You want patients to know all of your knowledge, to really understand what they're getting into. But what we see in sales is that that isn't really what our patients are looking for. Every once in a while, you'll have someone, and I know where your brain is going because I always have the doctors that say, well, what about this one particular scenario? Yes, of course, you'll have someone who wants all of the specifics, and that's wonderful. But that's what, 1 in 100, 1 in 1,000? So it's important to design a new patient experience that is meant to sell. And that means that we need to train our treatment coordinators to capitalize on their personality, to care deeply, and also sometimes to undo certain aspects of their knowledge within the field so that they can show up as the best possible treatment coordinator and advocate for helping patients get started. So if you've promoted a treatment coordinator from the clinic and you're seeing frustration in sales, highs and lows in conversion, maybe patients leaving confused because they aren't sure which option to select, my guess is that that treatment coordinator is leading their prospect into the weeds. And it is really hard for people to choose. They need us to help them choose. The treatment coordinator is the guide for making a decision. If you have someone from the front desk and they're struggling, or you have someone who's come from the outside with no background and they're struggling, what they need in training and guidance is different. We have to take into consideration how people were raised, what they believe about money, what is their professional background, and then how do we use that for the benefit of the experience and for the benefit of the practice, its ability to sell, and what are the things that need to be undone or reworked or reframed that are potentially sabotaging the sales process. So this is why I love so much supporting the growth of orthodontic practices, because it's personal, because every treatment coordinator and every orthodontist is different and unique and comes with a package of experience and personality and beliefs that are going to add to the sales experience and sometimes make it more complicated, sometimes reduce the ability to succeed. And so when I come in as a coach and we go through this whole process of breaking things down and discover limiting beliefs and sabotaging actions or just ways in which things are being done that are inefficient, and then realign them so that you have the ability to be more successful, the wins are so sweet because they're personal. And we're in a business, in an industry of caring for people in a personal, unique way. So your sales experience and what it means for the treatment coordinator and how the treatment coordinator is able to show up and be an advocate for the practice and the patient should also be personal. So hopefully you've got a couple takeaways from this, an opportunity to maybe shift in training or perspective as you're supporting your treatment coordinators. Please reach out if there's anything that I can do to help in supporting your journey from wherever you are today to better.